Welcome to Mostfit Physiotherapy Center. My name is Nancy, I'm a physiotherapist. Today we have our patient here, so we've been coming with issues of the knee. Being a sports person, having done several physiotherapy and dry needling sessions, he has really improved and shown positive feedback with the sessions. And today I want to demonstrate on dry needling, which is use of dry needles for the management of, like for his issue, the knee. Considering the treatment process, cleanliness is always key, so we have to clean the treatment area. And with dry needling, we do use specific needles that are called dry needles. And what that means, it's a needle without medicine in it. It's dry, like it's called. And with our patient here, one thing is to locate the quadricep muscle. So you can lift your leg up. Yeah, you have to locate the insertion of the quadricep muscle towards the knee area. So from there you have to get the trigger point. A trigger point is a tight band of a muscle at a specific region along the muscle fiber. So, and with the patient response, they'll tell you where they feel maybe some tightness or, yeah, can you feel anything there? So once they respond and once maybe you can feel some tightness around that area, that becomes your point of needling. So we are going to insert the needle at the specific point. So another thing is let the patient know what dry needling does. It's working on the specific muscle fiber, and that means when the patient tries to move the specific area of treatment, it might cause extra tightness because already the needle being in, it means it's interfering with the movement of the muscle, and that means the patient should be very still, because again, movement with the process happening, it may lead to some kind of, let's say, a numb kind of feeling. So at all costs, let the patient be still. And again, getting the response, maybe you can tell me how you're feeling. Then it should be for 30 seconds to 60 seconds, that is 1 minute, for a proper outcome, if I may say so. And then after that, once a needle is used at a specific area, it should be disposed. So having worked on the quadricep tendon, now we can also try locating the patella tendon for the same, because again, we are working on the knee area. So I would like you to just flex your knee just a little bit, yeah, like that. Once you feel the patella, that is the kneecap or the patella bone, you are able now to feel the patella tendon, which is between the tibial tuberosity and the patella bone. Then at that point, also get a trigger point with relation to what maybe the patient is feeling. And considering it's not the first session for dry needling, and having shown remarkable recovery, so our patient at the moment, he might not even feel anything, but having introduced dry needling as a form of treatment, you're able to know what, as a therapist, you're able to know on what you're working on specifically. So you feel the trigger again. Can you feel that? So again, can you stay for 30 to 60 seconds? That is for maximum results. Then after that, you can. Remember, with dry needling, with issues with musculoskeletal pain, post-cesarean section, scar pain, with people who come with low back pain. So in case you're having all these issues, any kind of neuropathy, consider us Mostfit Physiotherapy Center for treatment. We are located along Ring Road, that is Parklands, inside the Kenya Drapers compound. You can also get us through our social media handles at Mostfit Physiotherapy Center.